Good morning, everyone. This is Dr. Pete Peduzzi with the American Back Centers and the Disc Relief Centers of Pittsburgh, here with another podcast this great Wednesday morning. You look outside, it's beautiful weather outside, and just a great day. So I'm glad you're here with me to listen to what we have to say on this podcast today. We have some interesting topics. Last week we talked about Hashimoto's thyroiditis, an autoimmune thyroid condition, which is very unfortunately common in today's society. A lot of people are suffering with it. It's very difficult to deal with, and we talked about some of the natural ways to fix this problem and deal with this problem, and some of the problems with the medical model that's out there treating with medications that are just band-aids or treating the symptoms, not really addressing the cause of Hashimoto's. So today we're going to talk a little bit about cortisol levels in our children, how to avoid that, how it could be potentially contributing to their behavioral problems as well. You know, we just want to give them, again, medications for these behavioral issues, all types of other things that really don't address the cause of the problem. We're going to dig a little bit deeper today, and this will obviously apply to adults as well and behavioral issues, but specifically today we're going to talk about cortisol levels in children today. So definitely stay tuned for that, and later on this podcast today as we really highlight that topic today, cortisol levels in children and behavioral problems. So again, if you are new to this podcast and new to this office, American Back Centers, located here in Wexford, PA, the Disc Relief Centers of Pittsburgh. We've been doing this for over 50 years now. Dr. Dennis Miskovich, the late Dr. Dennis Miskovich, started this disc-specific practice, this disc specialty center. One of the first doctors to institute this type of care, he saw the groundbreaking research by Ramos and Martin, two neurosurgeons, and for the first time still to date, the only research, and again, research is so important. I tell people, before you pursue any treatment option, get the research. Don't believe me. Don't believe any doctor you see on any podcast, radio show, whatever it may be, TV, you name it, until you do your own research. Do your own research first. You will see that with this procedure and many of the procedures, if not all the procedures we offer here at the Disc Relief Centers of Pittsburgh, American Back Centers, they're all research. Harvard University, Johns Hopkins, the Mayo Clinic, Duke Medical Center, some of the best institutions in the country researching this procedure, vertebral axial decompression, VAX-D for short. We're one of the first practitioners, first centers in the country to institute this type of care back in 1994. Dr. Miskovich purchased not one but two tables at $125,000 a piece. They're not cheap, but you get what you pay for. You're getting the most sophisticated technology. Now, we've upgraded the technology over the years. We have a third generation unit now. The most advanced AI, artificial intelligence technology. Electronic biofeedback, sensing the patient's body weight, and we can set the perimeters very effectively, allowing for pinpoint accuracy, pinpointing those individual levels, whether it's in the neck or the low back region. Number one, allowing for increased patient comfort. Patients readily fall asleep when they're getting their disc treated, and more effectiveness. We're getting better results with the more difficult cases. So some of the more difficult cases that have been through multiple failed back and neck surgeries, people contemplating surgery that have been told that surgery is their only option. And you would hope most of the surgeons out there will tell people, and you hear it often, which is good, come back and see me only when the pain is unbearable or you've tried everything else. Exhaust all your options first. Some of the best surgeons in the country at the Cleveland Clinic told us that at a seminar, treating this spinal care seminar, I should say, at the Cleveland Clinic, addressing, going over all the options, physical therapy, chiropractic, VAX-D. And again, if you look at these so-called decompression devices out there claiming to do what VAX-D does, where's the research? They have some research stating that they help people reduce pain, but there's no true research showing that they actually produce negative pressure. The negative pressure is essential to pull fluid and nutrients back into a compressed spine. Again, when we look at the model here, you see a healthy disc. You see a disc that's now compressed. Remember, there's no blood supply after the age of 25, so there's no way for this disc to rehydrate itself, to get oxygen and nutrients back into the disc because there's no blood supply. So by taking pain meds, epidural, surgery, they're just snipping off pieces of disc that may be bulging. If, as you can see, the bulge there, if not herniated, and maybe disc material that's spurring, as we see in the model, has the disc starts, the spaces, I should say the bones of vertebrae start to degenerate, bone spurs form, osteophytes that eventually want to fuse together, and you can see that at the bottom there, how the spine will fuse, and we want to avoid that. So we can open up the spine with this treatment, getting a disc like this or this back to this again, pouring the water, oxygen, nutrients back into the compressed spine, restoring the health of the starved degenerative disc. So if you have a degenerative disc, chances are you also may have the beginnings, if not already, a bulge or herniation, contributing to sciatica, to pain, to spinal stenosis, narrowing those canals, and now you have problems. And they want to, they want to do all types of things. They want to send you to a pain clinic, doing epidural or steroid injections, nerve blocks, spinal surgery. Physical therapy has its limitations. We do therapy and rehab here at our office, but there's a time and a place for it. And especially if you've already done physical therapy or chiropractic care, we're not going to do that here. We're going to take a step back. We're going to treat the disc with a treatment specifically FDA approved and researched with a documented 92% success rate right here, exclusively in the Pittsburgh area at the American Back Centers and the Disc Relief Centers of Pittsburgh. We help people. We've helped literally thousands of patients over the last 25 plus years avoid the potential permanent complications with spinal surgery. So visit our website, www.americanbackcenters.com, www.americanback, like your back, B-A-C-K, centers with an S.com. You can actually make an appointment right on the website, as well as learn more about what we do. And if you have any questions, feel free to call the office. Really, the only way you're going to know is by coming in for a consultation and evaluation. We go over your x-ray, MRI, if you have one. If you don't have one, we can do x-rays right here in the office. And we have a very convenient MRI facility right across the street. So if you need an MRI, and we have medical necessity now, we can prescribe you one, send you across, get you an appointment scheduled, send you across the street and get the MRI. When we get it back, we can discuss it together and go over and see if you're a candidate, if we can accept you for care here. And if we can, there's a documented 92% success rate with this wonderfully successful procedure used in over 300 centers worldwide. There's centers in India, Europe, medical facilities, MDs, orthopedic surgeons, chiropractors, physical therapists that are trained use this in their office. There's approximately 3,000 patients a day currently being treated with VAX, the wonderful, wonderful procedure that's researched. Again, not glorified traction. There's so many of these decompression devices out there taking thousands of dollars from patients, and they're glorified traction. They stretch the body apart, and that's all they really do. They claim to create negative pressure, but where's the research? Where's the documentation? We have the proof that what we say is occurring. And that's why it works. And that's why it's been so successful. And we have the latest technology right here at the Disc Relief Centers of Pittsburgh and the American Back Centers. So again, we've been doing this for a long time. So we ask you, if you're out there listening, you yourself or you know someone suffering with severe back or neck pain, unresponsive to your current treatment, you want to avoid surgery, pain medication, epidural injections. You've already had a failed surgery. You don't want to do it again because look at the stats. With each subsequent spinal surgery, the success rate goes down. The first one's not very does not have a very high success rate. The subsequent surgeries have a lower success rate than the first and the subsequent surgeries, and a higher rate of complication, scar tissue infection, bleeding that can lead to blood clots that can kill you. Dwight White, the great Pittsburgh Steeler, Steel Curtain, on his fourth or fifth, I don't remember exactly, fourth or fifth back surgery. It doesn't really matter. Fourth or fifth back surgery, he died from a blood clot. Now, that's not typical. What's typical is scar tissue. They have to rip out ligament, bone, and tissue every time they go in, causing potential damage. And they're just snipping off a very important piece of disc. Now you have less disc or bone they take out, supporting the spine. So what do you think happens? Compensation and more problems occur, and that's why most people have to go back for subsequent surgical procedures, because the first doesn't work and causes more problems in many cases. Now, there may be a few people that you've talked to that have done well with surgery. The question is, how long is it going to last? Because it's not really addressing the compressive cause of the problem. It's only a matter of time. The disc is still degenerating. The spine is still compressing. And as it compresses, what happens? The disc still is being starved of nutrients, so the disc is desiccating, degenerating further. The bones are now forming those osteophytes that eventually want to fuse, very much like a knee joint or a hip joint. The cartilage goes bone on bone. Fortunately, we have a procedure for the spine, unlike the knee or the hip, that can actually open that space up, prevent the space from fusing, allow the retraction of water and nutrients in by creating that vacuum, sucking water and nutrients back in. But more importantly, sucking the disc material back into place, pulling it off the nerve, if it's pushing on a nerve, taking it out of the spinal canals, relieving the nerve compression, and relieving your narrowing or your spinal stenosis, whether it's the foraminal stenosis or the central canal, the spinal stenosis. So really the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there that actually does what it says it does. So we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. So don't wait until your condition worsens. Call us today. We do have a number. You can visit our website. You can schedule an appointment right on the website as well. 724-935-3300. 724-935-3300. All right, we're going to get into the article, and then we'll come back and talk a little bit more about what we do here. So we talked about Hashimoto's last week. This week we're going to be touching on elevated cortisol affecting your child's behavior. So this is, very important to note. Many people are dealing with this type of problem, especially with their kids, and as well as, cortisol levels in adults as well. So this, in my opinion, applies to both. So we usually do a summary. Again, this is from McCullough.com. Thank you, Dr. Joseph McCullough, for the great information and the great things that you do for our public, our general knowledge. And so he goes on to state, higher hair cortisol levels in children, especially boys, are linked to behavioral problems, environmental stressors. Maternal stress indirectly affects child behavior through elevated cortisol levels. Bullying experiences affected cortisol levels. So if your child is being bullied, which is, very unfortunate, but unfortunately common today in schools, as well as after school and sometimes on the bus before school. Bullying experiences affect cortisol levels in patterns in children with gender differences observed. Cortisol levels influence how victimization impacts mental health and brain development. Chronically elevated cortisol levels leads to various health issues, including brain tissue damage, accelerated aging, even in our children, believe it or not, and unhealthy eating habits. It's critical to maintain balanced cortisol levels. To reduce cortisol levels, increase intake of healthy carbohydrates while avoiding processed foods. For those with a compromised gut health, which we see even in the adult population, we talked a little bit about leaky gut last week and its correlation to Hashimoto's thyroiditis, those holes in the gut that can occur over time from poor diets and stress and environmental stresses as well. Same thing goes with cortisol. For those with compromised gut health, starting with pure glucose, dextrose, helps heal the gut. So we're going to talk more about that today when we go over this article. And finally, aside from switching to a targeted high-carb diet, you should also address your stress levels to keep your body from producing excess cortisol, and consider taking progesterone, which has an anti-cortisol function. So as we skip on down, you can see here recent research has shed the light on the complex interplay of factors affecting stress levels and behavior in children, as measured by hair cortisol concentration, HCC. Hair cortisol concentration measures long-term exposure to cortisol, a hormone released in response to stress. Unlike blood, saliva, or urine tests that reflect short-term cortisol levels, HCC, the hair, provides an assessment of chronic stress over weeks, if not months, which is more accurate and the better way to go. Since hair grows at a relatively consistent rate, analyzing segments of hair can give insights into individual stress levels over time. Further, a study of 11-year-olds in Spain found that higher hair cortisol levels are linked to greater behavioral problems, suggesting keeping cortisol levels lower could benefit the youth. Next paragraph, as you can see here, behavioral problems associated with higher cortisol levels in boys. A study of 11-year-olds in Spain found that behavioral problems and environmental noise were significantly related to HCC. And that's very important to note. Sorry about that popping up there. Explaining 5% of the variance in cortisol levels. Interesting, when the analysis was more specific to sex, these associations were observed in boys, with stressful events also playing a role. Together, these factors accounted for 16% of the HCC variance in male participants. So as we skip on down, it's showing a bigger correlation with boys than girls. Parental stress could indirectly affect child behavior through elevated cortisol levels as well. The relationship between behavioral problems and HCC was only significant in boys, suggesting potential sex differences in how cortisol affects behavior. As we mentioned above, other factors involved include bullying, sleep problems, if they're not sleeping, getting enough sleep, experiencing stressful life events were associated with behavioral issues or factors that could influence cortisol levels, underscoring the need to consider both environmental and other factors when assessing your child's stress levels and overall well-being. Skipping on down, additionally, lower exposure to traffic-related air pollution, higher levels of physical activity were linked to better health-related quality of life. Sleep problems are associated with higher maternal stress and behavioral difficulties, revealing the importance of managing stress at the family level. Stressful events, all types of stressful events, whether it's in the family, divorce, other types of death in the family, also related to lower levels of physical activity, showing the long-term impacts of stress on the child's lifestyle habits. Study found that higher neighborhood greenness was associated with lower environmental noise and reduced traffic-related air pollution. So if you have more trees, more bushes, you're more out in the country, going to be a little bit better as well, as opposed to having environmental noise and traffic-related air pollution, contributing to cortisol levels, stress, environmental stress, and behavioral issues. This suggests that green spaces may act as a buffer against environmental stresses, which just makes sense. Surprising link as we skip on down to noise exposure, lower cortisol levels. Contrary to expectations, the study found that higher exposure to residential environmental noise was associated with lower cortisol levels in children. So if you have some noise in the area, whether you're near an airport, residential area with a little bit more noise, lower cortisol levels in children. This challenges the conventional understanding of noise as a stress-inducing factor. While previous research has shown mixed results, while some studies reporting higher cortisol levels in children living in noisier areas, others finding no significant impact or effect. The study's findings suggest a more complex relationship. One hypothesis is that long-term stress exposure could lead to lower hair cortisol concentration, as observed in adults living in stressful economic situations or those experiencing childhood trauma. Also, lower HCC levels may affect a lack of hypothalamic pituitary adrenal axis, which produces cortisol, reactivity in children exposed to chronic high environmental noise. It's important to note that noise exposure in the study was estimated based on outdoor levels, which may not accurately reflect indoor exposure or noise levels in other contexts in your child's environments throughout the day. So when we talk about bullying, unfortunately, we see a lot in schools, after school, on the bus. Child stress hormone levels may also play a surprising role in whether they become a bully, victim, or neither. Research uncovering links between cortisol and bullying behaviors in children and teens. However, the relationship is far from straightforward. Some studies found that bullied children had lower cortisol reactivity than their peers, meaning that their bodies produced less cortisol in response to the stress. Yet other research shows bullying victims had elevated cortisol reactivity. When looking at overall cortisol levels throughout the day, most studies observed that bullied students had higher total cortisol. It just makes sense. They have more stress. They're being bullied. This suggests that their bodies were in a chronically stressed state, especially if the bullying is going on for a long period of time. It's not being addressed. Both cyber bullies, cyber victims displayed higher total cortisol levels. So even the bullies are being stressed. As I can say, obviously being a bully is going to be stressful because you're not happy probably with yourself. So now you're taking out on other people. So they also have higher total cortisol levels due to their stress. The picture gets even more complex when examining daily cortisol patterns. Bullied youth often show a flatter daily cortisol curve with less of the normal rise and fall. This disrupted rhythm may affect how chronic stress from bullying throws off the body's natural cycles. The child's sex also appears to influence how cortisol relates to bullying experiences. Some research indicates that verbal bullied girls had lower cortisol levels compared to boys. Another study found that only bullied boys showed significantly lower cortisol levels and a flattened cortisol responses to stress. But these gender differences highlight how bullying may affect boys and girls differently on a psychological level. So as we skip on down here, talks about the prefrontal cortex plays a key role in emotional regulation and decision making. And the stress response reacts to bullying may shape their brain development in ways that impact future behavior and mental health as well. So that's not good. So beyond direct relationship with bullying, cortisol also influences how victimization affects a child's mental well-being. Multiple studies found that higher cortisol levels strengthen the link between peer victimization and depressive symptoms. In other words, bullied children with elevated cortisol were more likely to develop depression as well. Cortisol even impacts how bullying relates to brain changes as well. So health risks with elevated cortisol levels, we know it's a stress hormone. Cortisol, primary function of the body, is far more critical. Its main job is to act as a safeguard, preventing the blood glucose from plummeting to dangerously low levels. This vital role protects you from slipping into a potentially fatal hypoglycemic coma. Understanding cortisol's true purpose led this article, the author of the article, I should say, to a significant shift in thinking about low-carb diets. The hormone's method of action, while proactive in short term, has very detrimental effects if levels remain consistently elevated of cortisol. So the steroid hormone, cortisol's name reveals its connection to glucose and the origin in the adrenal cortex, glucocorticoid. When the blood sugar drops, your liver's glycogen stores are depleted. Cortisol steps in. It triggers the breakdown of lean muscle, bone, and even brain tissue into amino acids. Your liver then converts these amino acids into glucose, glyconeogenesis. This insight highlights why long-term adherence to low-carb diets may not be ideal, especially if you're under a stress induced cortisol levels, high cortisol levels, stress. If you're under a lot of stress. While both low-carb eating and fasting can be beneficial short-term strategies for those struggling with weight and metabolic inflexibility, it's critical to reintroduce carbs once metabolic flexibility is restored. Failing to do so can lead to decreased metabolic health and impaired mitochondrial functioning. So the effects on fat and inflammation: cortisol also mobilizes stored fat through lipolysis. The due nature of cortisol initially is anti-inflammatory but pro-inflammatory when chronically elevated, underscores the importance of maintaining balanced levels. Chronic stress, prolonged low-carb diets, persistent high cortisol is not conducive to long-term health and longevity. Chronically high cortisol levels have wide-ranging negative effects on your body, damaging brain tissue. So this happens in the kids as well, leading to dementia later on in life and depression, and may also accelerate aging. High cortisol impedes the building of healthy tissues, which is critical to healthy aging, and stimulates the release of neurotransmitters that trigger food cravings. So guess what? You're going to eat more. Progesterone's role in reducing cortisol levels, one of the most effective and straightforward methods to reduce cortisol levels in your body, is by using natural, non-synthetic progesterone. This naturally occurring hormone possesses potent anti-cortisol and anti-adrenaline properties, making it a valuable tool in managing stress and its psychological effects. It works several ways to combat the effects of stress on your body. First and foremost, it directly counteracts the effects of cortisol, helping to lower its levels in the bloodstream. This can help reduce stress symptoms and improve overall well-being. Progesterone enhances the effect of GABA, the primary inhibitory neurotransmitter in the brain. This activation promotes relaxation and can help reduce anxiety. Another key aspect of progesterone's stress-fighting abilities lies in the moderation of adrenal gland activity. By regulating the production of stress hormones, including cortisol and adrenaline, progesterone helps maintain a more balanced stress response. It can also help with sleep quality, which is critical to maintaining healthy cortisol rhythms and overall stress management. Many other benefits of using progesterone for stress management are numerous. Less anxiety, irritability, improved mental stability, and as we mentioned, enhanced sleep quality. Physical symptoms of stress, such as muscle tension and headaches, often decrease as well. While progesterone can be highly effective in managing cortisol levels, it's important to note that hormone therapy should always be conducted over the guidance of a healthcare professional. Proper dosing and administration are critical for the appropriate results and minimizing potential side effects that can occur. And the right approach can vary from person to person depending on their specific needs. So again, it needs to be monitored in the correct fashion. Also, regular exercise, a balanced diet. Stress reduction techniques such as meditation can also complement the effects of progesterone therapy in managing cortisol levels and overall stress. So finally, reducing your cortisol levels by increasing carbohydrate intake, not reducing it. So remember, we talked about linoleic acid. You should be avoiding processed foods, high fructose corn syrup. This can disrupt the healthy gut, and contribute to endotoxin production, leading to that inflammation, increased cortisol, and eventually that leaky gut syndrome, those holes in the gut, and gut inflammation, as we talked about last week. We talked about Hashimoto's thyroiditis, and they theorized contributing factors to potentially autoimmune disorders is leaky gut syndrome. So aside from switching to high-carb diet, you should also address your stress levels, keeping your body from producing excess cortisol. Consider taking progesterone, which is an anti-cortisol functioning as well. If you're unable to tolerate healthy carbs, try pure glucose, which is more commonly called dextrose, for a few weeks. This is especially useful for those who are seriously damaged, who don't have the capacity to virtually eat any carbs. You can go on a high dextrose diet for your gut to start to heal. You'll save more cell energy, which allows you to introduce more carbs back in your diet. helping you to restore your mitochondrial functioning. So they talk a little bit about how to use progesterone. We're going to skip on through that. Ideal way to administer progesterone. There's many different ways you can do that. Is used transmucosidally on your gums, as he advises in this article. You can do it that way. There's creams as well, but they recommend that method as being the most effective method. And using vitamin E as well also helps protect you from the damage from the LA, linoleic acid. You also need to be careful with vitamin E. You use too much of it. Supplement vitamin E on the market is worse. So some of this synthetic he's talking about, vitamin E on the market, is worse than taking nothing at all. So taking a natural vitamin E is from a whole food source is always the best bet. You want to avoid, so again, a natural vitamin E labeled as D-alpha. This is the pure vitamin D, which your body can use, as opposed to the synthetic vitamin E, which is not something your body can use. So as we skip on down here, he gives you some recommendations on where to find a good progesterone. Simply Progesterone by Healthy Natural is pre-mixed with vitamin E and MCT oil. Again, while Healthy Natural states that this product is topical use only, he recommends applying it to the gums by rubbing it on your gums. So the revolutionary path to health and longevity, again, he talks about his book, Your Guide to Cell Health, Unlocking the Science of Longevity and Joy, which he mentions. Carbs Made Simple, too, as well. The method that he discusses in the book ranks carbohydrates based on their impact on biology, specifically in relation to your gut health. This approach recognizes the traditional complex versus simple. Likely does not tell you the whole story, but when it comes to individual outcomes. Instead, it suggests that the relationship between your gut health and carbohydrate metabolism could be the key to unlocking improved overall wellness. It's not about following a one-size-fits-all diet, but rather than undertaking how your unique gut biology interacts with the different types of carbs. And only you will know that. So this approach addresses and favors simple carbs over complex. This is because they usually have less than optimal gut health. If you have a compromised gut system to begin with, as we've talked about last week, and you consume complex carbs, the fiber and prebiotics in these carbs can feed oxygen-tolerant gut bacteria and actually make your symptoms worse. So you got to get your gut fixed first, and then you can introduce the more complex carbs. So starting with the green category, are the most easily digested simple carbs: dextrose, sucrose, and white rice. Very easy digestible simple carbs that give a quick energy burst without overtaxing your compromised digestive system. You will focus on these carbs initially because simple carbs provide a quick energy boost to your cells and mitochondria. Next is the yellow category, which we see here, which includes carbs that offer more nutrients and fiber compared to the green category, but are still relatively easy on the digestive system. This includes root vegetables, pulp-free fruit juice, whole fruits, fruit juice with pulp, and maple syrup. Then we get into the red category. So we talk about the red category as we skip on down here. We'll get to that. And as your gut health improved, you can switch your primary food source to whole foods, not just the juices, which they talk about here as well. The red category, again, is non-starchy vegetables, starchy vegetables, beans and legumes, and whole grains as well. Just be careful with the beans and legumes. As we talked about the lectin issue, Dr. Gundry, and so on. So once you're able to include more complex carbs in your diet, you'll start to notice significant benefits. You'll be able to extend the time between meals between 4 and 6 hours, and many people find that they can comfortably switch to 3 meals a day approach. This is because complex carbs digest more slowly, providing a steady stream of energy. So this is the article I want to touch on today. This is from Macola.com. I hope you enjoyed this article. And again, you can get it right from his webpage as well. We can send a copy to the webpage again is drmacola.com. We can also send you a copy of the article. Just call the office, 724-935-3300, or visit our webpage again, www.americanbackcenters.com. We are the Disc Relief Centers of Pittsburgh. Again, we specialize in treating these difficult disc-related conditions. We were even featured on Channel 11 News. WPXI heard about all the people we've helped here avoid the potential permanent complications with spinal surgery, and there are many. And many people have more problems, and they have to suffer now with more disability because now they have scar tissue and other permanent complications, infection, bleeding, blood clot, and damage when they go in there every time and rip out ligament, bone, and tissue. So we actually have a DVD if you still have a DVD player at home. When you call for information, you schedule your consultation here, we can send you out an informational packet, but also the DVD with some great information when we were put on Channel 11 News, because they brought the TV cameras out and they saw the people we helped and wanted to get that out to the general public. We also, I just want to, before I finish up today, we see a lot of workers' comp and auto cases here as well. We have a great booklet, a blue workers' comp booklet and a yellow auto accident booklet. Just call the office and you can receive these free of charge. The blue booklet is showing you your rights when you're hurt at work. And many people are taken advantage of by workers' comp or auto. They get hurt in an auto accident by the insurance companies or their work. And we can help you get through that process. In many cases, you may not even have the correct diagnosis. They may be treating you with these panel workers' comp doctors. You've been hurt at work. Now they want to send you back to work and you're still in pain. You got pain maybe going down your leg, down your arm, and they're telling you have a lumbar or cervical sprain strain, but never did the MRI to see if you have a disc problem, herniated disc or bulging disc. Call our office. We can get you in here. We can get you the prescription for an MRI, send you across the street or any MRI facility you want to go to, and finally diagnose that disc problem. We have the best treatment options here. In some cases, covered by insurance fully, if not partially, in the rare and the worst cases, and helping you with these workers' comp issues, getting you back to work and getting you out of pain, but more importantly, getting you the correct treatment and diagnosis when you're going to these panel doctors and they're just feeding you pills or doing physical therapy that's not working for you. You're not getting anywhere, and now they want to send you back to work and you're still in pain. Same thing with the car accident, personal injury cases. Misdiagnosed you, never did an MRI, have no idea that you may even have a disc problem in your neck or the back. Give us a call, visit our website, schedule an appointment, schedule that consultation, and get these booklets. The blue workers' comp and the yellow auto accident booklet showing you your rights as an injured worker, helping you avoid the potential mistakes you can make in these type of cases as they, in many cases, intimidate you. And more importantly, we do the documentation, we get you through the process, whether it's workers' comp or auto, but more importantly, getting you well and getting you out of pain and solving the problem, treating the structural cause of the problem, not just treating the symptoms, treating the cause of the problem. We do this all without the use of drugs, injections, or surgery, non-invasively, non-surgically. Finally, I want to make mention, I do Department of Transportation physicals. So if you're a truck driver, a bus driver, you need a CDL license, we can get you the medical exam and urinalysis right here at the Disc Relief Centers and the American Back Centers. We have very competitive prices. We get you in and out quickly and get you back on the road, trucking or driving a bus. So again, anyone with a CDL license, I do the medical exams right here. I'm a certified medical examiner with the Department of Transportation, so we can do it here, right here at the American Back Centers and the Disc Relief Centers of Pittsburgh. Finally, quickly, we talked about the Intramax, the all-in-one liquid multivitamin, and I did not show you the IntraKid for the kids. Really great products if you're looking for a starting point for a vitamin, a liquid or liquid vitamin that works. It has research, 100% carbon-bound organic, as you can see on the label there. 415 different nutrients in this product. The best starting point. You're getting what you're paying for. 1 ounce a day. It has to be refrigerated because there's no preservatives, nothing unnatural in the product. Everything you can think of is in this product. It's all natural, and it's a great starting point for a good nutritional program. The carbon oxygen gives you a burst of energy when you take it. And again, you're getting what you're paying for. And you're not having to suck down a huge horse pill. Those Centrum, those one-a-days, are just synthetic man-made vitamins in a lab, but they got tons of money because they're pharmaceutical companies, and they can advertise, convincing you that they're great products, but they're not. They're made in a lab. Nothing in that product is natural. It's not meant to be in the body. It can actually be more harmful than good. And finally, a very popular supplement we have here called L-arginine Complete. If you have problems with, as the brochure says, if you have heart health, blood pressure issues, it produces nitric oxide, which is a natural substance that we don't produce as readily as we get older, that dilates blood vessels. So when you're not dilating blood vessels, blood pressure goes up. So this helps reduce the blood pressure by dilating, producing nitric oxide, which naturally dilates blood vessels. So with that, poor sexual performance. What do you think that means? Less blood supply going to the penis. So when you take this product, you're going to see an improvement in blood supply to the penis. So improvement in erectile dysfunction. Lack of endurance, same thing, blood supply. Improving, dilating the blood vessels naturally. Reducing blood pressure. Reducing erectile dysfunction. Giving you more energy. Reducing inflammation. More blood supply to the brain. So increasing mental capacity as well. And as we mentioned, fatigue as well. So great product again, L-arginine Complete. Call the office if you'd like to try it. We have many different flavors. All natural, only sweetened with organic stevia. So no sugar, no artificial byproducts in the product as well. So we only offer the best, the safest, most researched products here at the American Back Centers and Disc Relief Centers of Pittsburgh. I want to thank everyone for listening today. We'll be on next Wednesday as well with another nutritional topic. Definitely tell your friends, your relatives, your neighbors about our podcast so we can get more followers, so we can get the word out there, so more people can be informed of what we do. Number one, helping people avoid spinal surgery, amongst all the other procedures we do here at the American Back Centers, but also getting the nutritional information that we talk about on this podcast out each and every week. I want to thank everyone for listening today. We'll be on next Wednesday with another podcast. Thank you very much. Have a good week, guys. Bye-bye.